This is my persuasive speech by Vanessa Bondi. These are my participants. HPV. Human papilloma vaccine is cancer prevention. HPV can lead to cancer. Working in a gynecologic office, we see HPV-related infections and cancers on a daily basis. Our patients go through constant and uncomfortable treatment for these cancers and precancers. Did you know that there is a vaccine called the HPV vaccine that can help to prevent these cancers? I want to share with you why the HPV vaccine is essential for every person to get because HPV is very common and can lead to cancer. The vaccination is safe and the guidelines should be followed to prevent cancer. And the vaccine has already started to show a decline in HPV-related infections and cancers. It is important to understand HPV is such a common virus, therefore the vaccine is essential to prevent these HPV-related infections and cancers. According to the Centers for Disease Control and Prevention, 80 million people are currently infected with the virus. HPV can be passed back and forth even when the infected person has no signs or symptoms. HPV is usually passed through sexual contact, and it is so common, most people will be infected at some point in their lives. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. Most of the time, the body naturally fights off HPV, but when it doesn't, the virus can cause major health problems in men and women. This includes cancers of the cervix, vagina, and vulva in women. For men, the cancers include cancers of the penis, and both of the genders can have cancers of the anus and back of the throat. The HPV virus can also cause genital warts. According to the CDC, HPV causes 33,700 cancers in men and women, and the vaccination can prevent about 31,200 of these cancers from ever developing. The HPV vaccine prevents future treatment of cancer and other precancerous conditions. Even though there is a screening tool for cervical cancer, HPV causes 10,800 cases of cervical cancer each year, according to the CDC. HPV also causes approximately 300,000 high-grade cervical lesions and other precancers, which may require invasive testing and treatment for those. The vaccine is so important because it will prevent most types of cancers and precancers, but it will especially prevent those that do not have routine screening tests, like the Pap smear. The HPV vaccine is essential because the virus is so common, and it is important to know the vaccine is safe and to follow the guidelines for the HPV vaccine to, again, prevent cancer. The HPV vaccine is safe and prevents cancer, and the guidelines set out will help to continue to decrease deaths from HPV-related cancer. The vaccine should be given to both genders when they are 11 or 12 years old. According to the CDC, the recommendation for the HPV vaccine is at those ages to protect against the cancers that are caused by the HPV infection. The complete series of the vaccine offers the best protection to girls and boys at this age because it gives time for their immune response to develop before they have become sexually active. The recommendations of the HPV vaccine for both genders is important because then they are more likely to reduce the spread of the virus between the genders. The Vaccines for Children program helps pay for these vaccines for children 18 years or younger who are uninsured. The vaccine is perfectly safe because it went through extensive safety testing before being licensed by the FDA. The safety record of the vaccine is backed up by 10 years of monitoring and research. The CDC and FDA closely monitored the safety of this vaccine after being licensed, and problems will be reported. So far, since the vaccine has been approved, there have not been any problems shown. The HPV vaccine is similar to others in that there are always risks, but the positives of the vaccine extremely outweigh the negatives. According to the CDC, with over 100 million doses distributed in the U.S., there has been no issues reported. There is no evidence of the vaccine causes problems with fertility. The vaccine causes the same side effects you would see with other vaccinations, such as pain, redness, or swelling in the arm where the shot was given. HPV guidelines and safety for the vaccine shows that it is essential for each person to get the vaccination because the instances of HPV have already started to decrease. The HPV vaccine is the prevention of cancer, and that has been shown in the US and especially in Australia by a decline in the presence of the virus and its effects. HPV infections have dropped significantly since the HPV vaccine was introduced over 10 years ago. According to the CDC, the HPV vaccine has caused a decrease in 71% of infections with HPV types that cause most HPV cancers and genital warts among teen girls. Research has also shown that the vaccine provides long-lasting protection for at least 10 years without becoming less effective. Additional data suggests that the vaccine will continue to work beyond 10 years. Australia has the highest vaccination rates through implementing the National HPV Vaccination Program. Almost all schools in Australia participate in the program, and there have been signs of success. The program is free in schools for girls and boys aged 12 to 13 years. The national government has funded a database that tracks vaccinations and screening records and will follow with those who are non-compliant. According to the Cancer Council of Australia, there has already been a 77% reduction in HPV types, responsible for almost 75% of cervical cancer. The HPV vaccine continues to show that it is cancer prevention. Since cervical cancer develops over 10 or more years, the role of the vaccine will continue to go down. This can automatically result in less abnormal screening test results, meaning less women will have to go through the stress of these tests and the treatment cycle with them. The infections with HPV types that cause most of its cancer and genital warts, according to the CDC, have dropped 71% among teen girls. HPV is a common virus and can lead to cancer, which is why the vaccine is essential for every person. It is important to know the vaccine is safe and to follow the HPV vaccine guidelines to prevent cancer. HPV vaccine is essential for every person to get, and there are statistics that show that HPV-related infections and cancers are already declining with the vaccine. HPV vaccine prevents cancer.